For the last 10 years, I've been living with two rare chronic pain disorders called complex regional pain syndrome and erythromelalgia. Over the last decade, I've worked with pain specialists, rheumatologists, neurologists, and other doctors from hospitals like UCSF, Stanford, and UCSD, trying to combat the neurological and neurovascular issues that were causing severe amounts of pain every day of my life. CRPS and erythromelalgia are both rare, debilitating pain conditions that significantly impact the lives of those affected. Both conditions involve the nervous system and can cause severe chronic pain, but they manifest in different ways. In my circumstance, it causes both my hands and feet to turn dark red, swell immensely, and inflict burning pain at nearly all times of the day. The way that I like to explain it to people is if you tied a bunch of rubber bands around your hand and sort of just dangled it off the side of the bed, so it would continue to swell up and there wasn't a way that you could alleviate the pressure that's building. You feel the most severe amounts of pain you've ever felt every day of your life, possibly for the rest of your life. It's a pretty terrifying and isolating experience to go through. The McGill Pain Index is a widely used tool designed to measure pain levels based on patients' subjective pain experiences. It helps quantify the intensity of different types of pain by comparing them to one another on a scale. This tool was developed to provide a more structured way of understanding how severe different pain conditions feel to patients. CRPS ranks at the very top of the McGill Pain Index, placing it above pain conditions like kidney stones, amputation of limb, and severe cancer pain. The high ranking of CRPS reflects the extreme, often debilitating nature of its condition. It's often referred to as the suicide disease due to the unbearable pain it can cause. I believe that the outcome of your experience with a chronic pain disease or condition is dependent on the information you know, the lifestyle you live, and the level of care of hospitals around you. It's also worth noting that neither condition has a cure. The laundry list of medications you try are there to help reduce symptoms, not get rid of them. After living with two chronic pain conditions for over a decade and having almost nothing from traditional Western medicine help, I learned how to heal my brain, mind, and body through lifestyle, diet, exercise, mind-body connection, and the processing of emotions and trauma. The American healthcare system will send you through an endless road of medication and procedures. By focusing on developing and maintaining your physical and mental health, you can not only reduce your pain, but improve your entire experience on this planet. I think that it's pretty unanimously felt that the American healthcare system is not great, but it's fascinating how bad it is for people who get chronic diseases and pain. Chronic pain affects over 1.5 billion people worldwide, with 50 million Americans living in daily pain. It's a leading cause of disability, costing the US up to $635 billion every year in medical expenses and lost productivity. And these numbers are only rising. Over the past 2 decades, chronic pain has surged, with factors like sedentary lifestyles, aging populations, and autoimmune conditions playing a key role. Chronic pain often goes hand in hand with mental health struggles, with many people dealing with anxiety, depression, and the isolation that comes with it. Over the last decade, depression rates have jumped by 25%, and that rise is closely connected to the challenges of living with chronic pain. Improving happiness and reducing stress are ways to manage pain from a biopsychological approach to pain management, which looks at the biological, psychological, and social factors contributing to pain. By reducing stress and enhancing well-being, you can positively influence how your brain perceives and processes pain. Focus on the mind-body connection and strategies like mindfulness, relaxation techniques, and positive social interactions can reduce the perception of pain by improving overall emotional health. Topics like these typically don't get the awareness they need until someone makes a documentary about them. So that's what I did. My intention behind the documentary is to help anyone dealing with a chronic pain condition navigate the world and improve their lives. But I believe that the learnings are applicable for everyone. If you're someone who has felt pain for a long time and the doctors don't know what's causing it, I believe the place to start is healing your mind. Trauma and emotionally taxing experiences might be affecting you more than you know. Pain can make things change quickly, and it's good to be prepared. I know how unbelievably difficult it is, and I want the trial and error I've gone through with healing to help make someone else's experience easier. As a disclaimer, the information provided in this documentary is based on personal experiences and research. It is not intended as medical advice, diagnosis, or treatment. Please consult a licensed healthcare professional before making any changes to your healthcare plan or for healthcare concerns in general. Things started off in my sophomore year of college at UCSD. I slipped in my backyard and landed oddly on my foot. Heard the snap and figured it was broken, but I didn't want to go to the ER as I thought there'd be a hefty price tag, and I was paying all of my own bills at this time. I waited for urgent care to open, and after an x-ray, the doctor confirmed I had a Lisfranc fracture dislocation. A Lisfranc fracture dislocation is a foot injury that involves a break in the bones of the midfoot or a tear in the ligaments that support it. The doctor said it was a serious injury and required me to get in for surgery as soon as possible. The first interesting thing that happened was during the consultation with the surgeon who operated on me. He moved my foot sideways, which caused a ton of pain, and the doctor told me it was a way to check if I indeed had a Lisfranc fracture dislocation or not. All doctors I've spoke with in later years said there's no reason a doctor would have to test a break that way. Surgery was a stressful experience for a few reasons, but there's just a strong sense of anxiety being it was my first time getting surgery. The procedure involved putting a screw through the midfoot, which would later be removed once that injury was healed. The next interesting facet with this doctor was I actually woke up mid-surgery while they were operating on my foot. I raised my head, looked at them operating on me, and was able to ask what was happening before they put me back under. In the weeks following the surgery, I tried to stay off my foot as much as possible, though I did have to make food for myself on crutches, which was challenging. After some time, I had to go back to get the screw out, and the doctor told me he wanted to put a hard cast on to ensure nothing would happen to the break. When he put the wrap on, I immediately thought it was way too tight, and I told him that was the case. He said it was by intention and that there shouldn't be any room for me to move. I reluctantly accepted and decided I'd go back home. After the cast was on, the pain became consistently unbearable. Anytime I was doing anything other than elevating, my foot would swell immensely. I was unable to cook for myself while on crutches, so I had to go back home to Southern California at a family member's house. Within a night of being there, the pain became so excruciating that I tried to cut the cast off myself. I was unable to do so, so I tried to get it wet, thinking that might enable the scissors to cut through the fabric, but I still couldn't get it off. I got rushed to the ER, and when the doctor cut it off, I almost fell into the chair because there was so much relief. I have it as a core memory, seeing my purple foot go completely flush white. It was a really bizarre experience to see how quickly it changed. Ever since that point, I consistently had the effect that when I'd be doing anything other than elevating my foot, it felt like it was going to explode. It was swelling so immensely. It would quickly go dark red, swell up, and I had to throw myself on the ground to sit, elevate, and stop the swelling. I made a follow-up appointment with the surgeon in Santa Cruz so I could talk to him about what was happening. The doctor felt that it was common after surgery, and his recommendation was just to keep elevating as consistently as possible. During this time, I had to literally crawl around the house trying to elevate my foot at all times. Even while cooking, I had to prop my foot on the counter, and when I was sleeping, I had literally 6 pillows under my foot trying to elevate as high as possible because the pain was severe and sleep was becoming an issue. After a couple of months and the swelling still being present at all times, I was pressing the surgeon for help because my life had become very difficult. The doctor told me that he was unsure what was happening with my body and recommended I see a pain specialist. He told me it may be something called complex regional pain syndrome, or CRPS, and I should look into it as he didn't have much advice to give. He did mention that I should start by putting my foot back and forth between hot and ice cold water and rub it on rough surfaces like sandpaper. I'd later find out that this advice is contrary to recommendations from pain specialists and could actually progress symptoms more quickly. Upon meeting with the pain specialist, I received the diagnosis confirming I had CRPS. The doctor's recommendation was to start off in gabapentin and a series of sympathetic nerve blocks. Nearly every specialist I've worked with over the last 10 years has suggested pregabalin or gabapentin as a starting point, but in my experience, they offered little to no relief. These medications, which are anticonvulsants, are commonly used to treat anxiety. Pain and depression are often interlinked because they involve overlapping pathways in the brain, including regions like the amygdala and other areas responsible for emotional and pain regulation. For the sympathetic nerve blocks, the procedure involved injecting an anesthetic near the spine, targeting the sympathetic nerves to interrupt pain signals. I was told by specialists that if you catch CRPS, ideally within the first 6 months, sympathetic nerve blocks may help prevent the condition from progressing and becoming more permanent. Throughout the next month, I received a nerve block each week, but at the end of the treatment, my condition actually worsened and nearly my entire leg was being consumed by this terrifyingly dark purple hue and burning pain. The doctor told me I would have this condition for the rest of my life, and the next step was to get a spinal cord stimulator to make living more manageable. A spinal cord stimulator is a device that is surgically implanted near the spine, delivering electrical impulses to block or reduce pain signals traveling to the brain. It's often considered a last resort for people with chronic pain conditions like CRPS, but it's also the top recommendation to combat pain. I remember this moment vividly because the diagnosis terrified me. It felt like a doctor had told me I had a terminal disease and my life is over. Throughout my journey, I've realized doctors do not understand the harm that they're causing with their words or the level of fear that they inject into patients when delivering the diagnosis. In the HBO documentary Any of Us, Paul Basagosha, a professional mountain biker who suffered a spinal cord injury, was told he might never walk again. Paul and others in the film prove recovery can defy the odds and end up walking despite the expectations doctors gave them. In the book The Way Out by Alan Gordon, there's a section that highlights how the words medics use at the scene of a crash can significantly influence the patient's outcome, whether they believe they will survive or even walk again. The power of language in these critical moments needs to be understood from a patient and a practitioner perspective. The brain is unbelievably powerful, and in some cases, it seems if you believe something to be true, you can almost manifest it be reality. The inverse is true here as well. Similar to how athletes visualize themselves winning, you have to believe it's possible that your body will heal. After the diagnosis and the recommendation for the spinal cord stimulator, I decided everything was happening too fast. I just really couldn't make sense of my life disappearing, so I decided I needed to stop and do more research before getting the spinal cord stimulator embedded into my body. To this day, I still haven't gotten a spinal cord stimulator, and there's a variety of reasons as to why, but mainly it's the fear of something going wrong and the cost. Total cost for a procedure can range from $20,000 to $100,000 or more. Starting my junior year, I got connected with someone who used to be a paraplegic who can now walk. I was really thankful for the experience, and it was really interesting to hear all about her journey. She gave me a ton to consider about the healthcare system and alternative approaches for healing. I was pretty much open to anything that didn't seem like it was too risky. She recommended a ton of different herbs and supplements. I was trying different things like covering my feet in clay to remove toxins, but most of the things we tried didn't seem to help much. A recommendation she gave, which I found to be a fascinating experience, was acupuncture. I was always intrigued by meditation and mindfulness, and acupuncture was a big step in leveraging meditation in my life. I was always the person who was moving their leg or fidgeting with my hands, and acupuncture enabled me to finally stop moving my body and meditate deeply for an hour. At the acupuncture clinic in Santa Cruz, I worked with a woman for years and would talk to her about my journey, and she shared how she arrived to be doing what she was doing. There were times where she would talk to me about how the needle she was about to put into my body was going to affect me. She'd say something like, "This one will cool your body," and I swear I could feel a wave go through my body starting from my head down. It was a wild experience. After a few years of working with her, the CRPS symptoms remained, and she suggested that I consider her husband's approach to acupuncture to see if it might help. My original acupuncturist followed a traditional Chinese medicine approach, which was 20 to 50 small needles in targeted locations, while her husband used 3 to 5 larger needles that were hooked up with electrical current. Electroacupuncture is an addition to acupuncture therapy, where an electrical current runs from an electromachine through connecting cables that is attached to the heads of acupuncture needles, stimulate the muscle fascia via differing electrotherapeutic methods. I found it to be far too painful, and I didn't notice any benefits, so I stopped after a few sessions. The next major procedure I tried was hyperbaric oxygen therapy, or HBOT. While I'm not sure it made a significant difference for me personally, it has incredible benefits for a host of issues. HBOT involves breathing pure oxygen in a pressurized chamber, which allows your body to absorb far more oxygen than normal. This can boost blood flow, reduce inflammation, and help repair damaged tissues. It's been used to treat a variety of conditions like cerebral palsy, frostbite, and even traumatic brain injuries. I heard stories of people with CRPS going into remission after undergoing HBOT, which gave me a lot of hope at the time. However, the treatment is very expensive, largely because it's not covered by insurance for most conditions like CRPS. The healing potential of the HBOT is clearly documented, but access remains limited for many due to the high cost. The cost tends to be around $200 to $500 per hour, depending on how many sessions you pay for upfront. The recommended treatment was for 40 hours for CRPS, but due to cost, we could only pay for 20 hours. I'm not sure if it was hyperbaric or not, but after about a year, I started to experience instances of being able to do things that were previously very challenging. When you have a chronic pain condition, life doesn't just stop for you. I was missing out on a lot of college experiences and time that I couldn't get back. There's no good time for something like this to happen, but it was difficult not being able to experience things during such a fun time of life like college. It's very difficult to watch all of my friends enjoy life on social media, and I wanted to retain as much of my life as I could. I pushed through the pain and still do some things with friends at concerts or parties, but it was always a painful and challenging experience. I also didn't want to fall behind in school, so I maintained retained my courses. College can be pretty demanding as is, but tacking on a chronic pain condition divided my focus pretty heavily. For anyone familiar with the Santa Cruz campus, it is a massive hilly school. One of the hardest things was getting around on crutches. There was a van transportation that the school offered, which was amazing, but it was difficult to work around its schedule. There were a lot of situations that arose that made it difficult to be at the pickup spot by certain times, like if I needed to stay to ask the professor questions about the lecture, or if I hadn't finished dinner at the dining hall, but the van was arriving soon. The pickup locations also didn't have places to sit, so I'd have to sit on the ground or stand and fight through the immense swelling. I think the thing that made the experience extremely challenging for me was not having a support system, especially from a financial perspective. During all of this, I was still working 25 hours a week to pay for food and rent. Initially, I was working as a barista and a server. I knew that my job was going to be at risk, so for a few days, I tried to hide it, and I would fill my socks with ice from the ice machine to try and combat the swelling. But it's very clear to everyone that I was in huge amounts of pain, and I was told that I couldn't continue working at the restaurant until I was able to stand and move without pain. Fortunately, I found a new job working at the gym where I was occasionally able to rest my foot on a yoga ball in between swiping people into the gym and cleaning towels. As challenging as it was, I was able to maintain living in Santa Cruz and could at least retain that part of my life. Around the time of graduation, there started to appear glimpses of healing. While it still hurt a lot, started to be able to do things like play basketball or ride a bike in short instances. There was always swelling, but I could at least take my shoes off to cool my feet and rest, and it meant I could finally start incorporating consistent exercise, which was a massive change in my life. For a couple of years, this status remained slow improvement, no major downturns. Interestingly enough, the thing that gave me a strong instance of healing was going through a breakup. We were dating for a few years, so as many go through after a breakup, you try to improve yourself as much as you can. You want to be the best version of yourself and look as good as you can. In my diet was eating all whole foods, mainly protein, fruit, and veggies, fought through the pain, and exercised as much as possible. After about 6 months, I was in the best shape I've been since the original foot break. Felt amazing physically and mentally, and I was exercising for longer amounts of time, going for heights and weightlifting. After some time, my ex and I caught up over a dinner, and she seemed like a new person in a very positive way. I could tell she went through a similar growth pattern that I did and went through a positive life shift. When I asked her what she was doing to improve her life, she described that it was an intentional shift in focusing on the positive for any experience. Rather than getting annoyed at the loud dude at the other table in the restaurant, find something positive in the moment, like being able to spend time with your friends and enjoy the food that you eat. It was a simple concept, but implementing the practice had positive effects on the way I was experiencing the world. My body continued to trend in a positive direction, and I was the happiest I'd been in a long time. Maintained all of these habits, and slowly over time, I was living a life better than ever before. I had more empathy and patience for myself and others, and my pain levels continued to lower. The pain and the discoloration shifted from being heavily concentrated in my right foot and leg to now having pain and swelling in both feet. But rather than my entire leg and foot, it was primarily occurring in my toes. Part of the limb that you could see that was physically being affected with the red swelling changed. I do want to call out that the physical symptoms you see sometimes do not matter. You can feel pain without having physical symptoms like discoloration and swelling. This is unfortunately not known by all doctors, and I've heard multiple stories of people who are told it's just in their head and how to go through unnecessary suffering. 1 in 5 people experience chronic pain, and if you're one of those people who have a doctor that is not up to speed on the necessary knowledge, you might go down a path when you can't seem to heal. The tale as old as time is that you are put on medication that might help a little, but there are short and long-term side effects. Many of these medications also require that you increase your dosage over time as the benefits you previously saw dwindle. Chronic pain doctors make their diagnosis based on symptoms, and if your symptoms do not completely match the disease or the condition they're familiar with, it goes undiagnosed and you might not receive care, worsening or even causing the disorder to stay forever. Pain not only reduced and moved to both feet, but it started to appear in my hands as well. There was clearly a change happening in my body, so I spent time researching. Based on the physical changes and symptoms I was dealing with, it appeared that CRPS had morphed into a new neurovascular disease called erythromelalgia. I made time to meet with pain specialists in my area to get their input, and all the doctors maintained that I had CRPS and not erythromelalgia. It seemed not to matter. Both conditions you treat similarly, and there wasn't much assistance they could offer either way. I took their diagnosis as a misdiagnosis diagnosis and that they were just less informed than I was on the research. At some point during 2019, it became apparent that there had been a drastic improvement and people around me started to notice it too. Started being able to do multi-mile hikes. I was running and I genuinely thought I beat it and it was going into remission. Pain was still there every day, but living was so much more manageable. I'd have to take my shoes off during hikes, maybe sit a few times if it was a hot day, but for the most part, I started to think that part of my life was over. Pain levels were so manageable that I was able to travel to other countries and explore, a feat which felt impossible years before. It was difficult to look at old pictures and videos on my phone because of how scary my body used to look. To try and put it all behind me, I wiped the photos thinking that I was in the next phase. I do regret doing this because when you are dealing with chronic issues, it's helpful to have these specific timelines. Doctors always ask, and it's hard to recall because they're slow, gradual changes. As life was starting to feel normal again, I loosened up on my diet, I ate out with friends, I got drinks at the bar, and I just focused on enjoying life. In late 2020, I had the first instance of a downturn occur. I got some stabbing pain around the ball of my foot, which quickly became debilitating, so I stopped running, hoping that this would do the trick. In the coming days, the pain became so severe that I couldn't walk. I went in for an x-ray and they told me that I had a neuroma, which is essentially a calloused nerve. It basically feels like you're standing on a rock in your shoe. The recommendation from my podiatrist was to wear custom orthotics and see if the pain subsided. I attempted to continue walking on it, but after a couple of weeks, it was clear that the orthotics weren't working. Pain was severe and walking became unbearable, so we started a series of cortisone injections into the neuroma. These injections reduce inflammation by injecting a steroid medication into the neuroma. For CRPS patients, it's common knowledge that you avoid trauma to the affected area at all costs, but I could barely leave my house for over a month, so I decided that I had to do the injections. As we feared, it caused me to experience intense flares after each injection. Every time I left the hospital, my foot would swell immensely and the pain became severe for the next day or so. As I was well-versed in driving with my left foot from the original break, I was able to hold my right foot in front of the air conditioner and drive home with my left. After a month, the cortisone injections didn't work and I was in a really bad state. I decided I needed to get advice from the best, so I got a referral to Stanford. The appointment was far out, but I continually called them until I was able to get a cancellation appointment. When I finally met with the doctor, he thought we should try cortisone injections again as they are more effective, but also thought we should do alcohol injections. By this point, my condition was so bad that I had to be on crutches and the foot was almost constantly swelling. After 4 to 6 rounds with the podiatrist at Stanford, he felt that the only path forward was to do surgery. Again, for CRPS patients, this is the last option as it can not only bring back what you had, but it can make it far worse than before. I decided to move forward with the surgery and there weren't any complications. We got the neuroma out and I got home to bed, but when the medication faded, I feel the presence of this just diabolical pain that I hadn't felt in years, and I immediately knew what was coming. I couldn't do anything except have my foot elevated. I was in bed nearly all hours of the day, only leaving to use the bathroom or to try and shower. Had to sit on the ground in my shower with my foot in the air wrapped in a trash bag to avoid getting the wound wet. It was an ungodly amount of pain, and on one of the first nights back, I fully broke down, and it was the first time my partner saw me bawling my eyes out. I would have to slowly crawl to the floor while constantly holding my foot up in the air and sit on a skateboard to pull myself to the bathroom. The amount of fear that I had during this period of time was insurmountable. I thought I made the mistake of getting surgery and I pulled CRPS out of remission, but fortunately that didn't end up being the case. While it still did make my next week or so unbearable, it faded. Over the next couple of months, I was able to start standing with a walking boot and healing from the surgery. I believed that I was going to maintain the remission state and continue healing. After the neuroma surgery, my body began failing and I went through the most torturous period of my life. Getting through the most difficult period of time I could imagine changed me in such a positive way. After getting through to the other side, I view the world differently. The way I perceive experiences, the appreciation I had for myself, my friends, and the world drastically improved. It's pretty beautiful how so much good can come from that. At some point in 2021, my body started to go through a bizarre and rapid downfall. It started with the nails on my big toe basically dying for no reason, which started the CRPS pain again. From my experience, I thought that I could identify when CRPS and erythromelalgia pain were happening. Not that one was necessarily worse than the other. The experience I was having with what I thought was CRPS was less common, but was more severe. However, the feeling of erythromelalgia in my toes persisted almost constantly. Started being able to do less things, had to sit basically all the time, and I was again missing events my friends were going to. It felt pretty similar to when I first got diagnosed with CRPS years ago. Throughout my life, I've been an insomniac and had difficulty falling asleep. The scary thing about having a chronic pain disorder with insomnia is how they affect each other. I started to experience severe insomnia, where I could only sleep 3 to 4 hours a night from the pain. I got sleep medication, which I had to take nightly, but there was no pain medication a doctor prescribed that helped alleviate pain. It very quickly got out of hand, and even the sleep medication stopped working. There were multiple instances where I was up for 2 to 3 days because every time I was about to fall asleep, the pain would shoot me awake like I was being electrocuted. A vicious cycle was happening where the pain was so bad that I couldn't sleep, but because I couldn't sleep, the pain was getting worse and was spreading. The pain I felt in my nerves was without a doubt the worst pain I could imagine. It was genuinely torture. As the insomnia continued, I had tears in my plantar fascia, swelling of my bones and my metatarsal, and random knee pain emerged. I was constantly in doctors' offices going through MRIs, getting procedures done, and it was without a doubt the most difficult period of time that I went through. The pain was so constant and so severe, I felt it 24 hours a day for months. As I was on crutches and a majority of the time crawling around the apartment, we decided that we needed to move out of the city to an environment that would better enable my health. While waiting for our lease to end in San Francisco, I had a really cool opportunity to speak with Dr. Perret at UCSF. Dr. Perret is a pain medicine specialist with expertise in using the latest interventional techniques to control pain with less reliance on oral medications. My pain specialist thought my case was interesting and it didn't exactly seem like CRPS or erythromelalgia, and he wanted to get Dr. Perret's thoughts as he knew him well from school. Dr. Perret had a focus in managing pain and restoring function through neuromodulation, technology that delivers electrical stimulation or medication to targeted areas in the body. I don't want to speak for Dr. Perret, but my understanding of his idea on my state was regardless of if I have CRPS or erythromelalgia, something in between, you have nerve pain. You approach it the same way for the most part, and my need to have an exact diagnosis didn't matter. He encouraged me to consider the spinal cord stimulator if the state continues, as it would likely be the most effective option to stop the suffering. Towards the end of my time in San Francisco, a podiatrist I was seeing, who was one of the best doctors I've ever worked with, her name was Dr. Potter, recommended I get a second opinion from a friend of hers who was a pain doctor temporarily working out at her hospital. After reviewing my symptoms, the doctor agreed that the diagnosis was CRPS, and his recommendation was I start another series of sympathetic nerve blocks, as it had been about 9 years since I last tried them. I wanted to first check with the pain doctor I'd been working with, so I let my original pain doctor know the recommendation from the new pain doctor I saw. The reaction I got from my original pain doctor was a little shocking. He immediately responded that he doesn't do split care and maybe it was best I stick with the new doctor. It did catch me off guard, and I responded that I didn't mean to make him feel like I wasn't respecting his guidance. It was just a recommendation from the podiatrist I was working with, who was actually the person who referred me to this original pain doctor. I said I'd stop seeing the other doctor and stick with him. Found it pretty concerning that the pain specialist was so possessive to this degree and was so opposed to alternative medical advice that he was forcing me to drop other doctors if we were to continue working together. To think that you know all there is and all there will be to know is, in my opinion, especially concerning for a forever changing field like medicine. I continued seeing both doctors, but just had to filter the recommendations I was getting from the new doctor as if I was finding them through self-research. What I've always found interesting through my experience going through the recommended procedures and medications is the relationship between pain and depression. The brain regions that process emotional and physical pain are interconnected, particularly in the limbic system, which regulates emotions. This overlap is why conditions like chronic pain and depression often co-occur, and why treatments for one can sometimes help the other. As an example, gabapentin and pregabalin, or for me, always the first things brought up when talking to a new doctor about CRPS. Pregabalin and gabapentin are often used to manage pain, particularly neuropathic pain, because it affects neurotransmitters that are involved in both pain and mood regulation. Gabapentin is sometimes prescribed off-label for anxiety, even though it is not classified as an antidepressant or anti-anxiety medication in the traditional sense. The reason lies in its effects on neurotransmission in the brain. When I met with a doctor at Stanford to discuss ketamine and get their thoughts on my current state, Cost of ketamine was about $15,000, so I immediately let him know there was no way I could pay that. The doctor told me they were running a study on the effects for CRPS patients in transmagnetic stimulation. Transcranial magnetic stimulation, or TMS, is a procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of major depression. Called non-invasive procedure because it's done without using surgery or cutting into the skin. TMS is FDA approved for depression, OCD, and certain types of pain. I did what research I could, saw it was low risk, it was typically expensive otherwise, and it was Stanford, so I said I'd try it. The process was going to be 4 sessions in a row, done once per month, 3 months in a row. After the first month of sessions, I noticed no change in pain levels or mood, so I decided to pull out of the study. The main reason being traveling is really difficult when you have chronic pain. The next procedure I tried was a ketamine infusion. After going through it, I'm stunned that it's legal, given the US's opinion on things like marijuana and psilocybin. Ketamine as a treatment was consistently brought up to me since I was first diagnosed. When I first learned about ketamine as a treatment, I was having trouble even finding options for it near me. I also learned that the method of ketamine-induced anesthesia, which is what you're supposed to follow for CRPS, wasn't legal in the States. Ketamine-induced anesthesia essentially puts the patients into a multi-day coma-like state to reset your nervous system. The process lasts for several days, and the goal is to reset neural pathways linked to chronic pain conditions like CRPS. Stanford's cost was unobtainable. I found a clinic in San Diego where the cost was a little more manageable, but still very expensive and all out of pocket. The cost with this clinic was $5,000 for 3 2-hour sessions, 3 days in a row. On the first day, while the doctor was getting me all set up for the infusion, he was explaining how the dosage for treatment functions. I'm going off of memory, so take my recollection with a grain of salt, but I think he said the dosage for depression is typically around 0.2 milligrams per kilogram of body weight, while pain was typically 0.7, and he wanted to do 1 milligram per kilogram of body weight as it was for CRPS. I said I was cool with it, and the process began. They turned off all the lights other than a cosmic producer on the ceiling, gave me some headphones that had a ketamine music playlist from Spotify, and after a few minutes, my entire reality changed. Time almost completely stopped, and it felt like I was slowly falling forward, almost like I was being pulled into a black hole and being stretched infinitely. I didn't see anything in the real world, only what my mind's eye was creating. I started to go through my life journey, seeing all of the rights and wrongs I've done. I recall deeply thinking that they gave me too much, and this was my life flashing before my eyes. Tried to communicate with the doctor, but I wasn't sure if anyone was even in the room with me. Because I thought I was dying, I was trying to communicate with my girlfriend through the ether and was trying to tell her that I loved her. But after 2 hours, the first round of the infusion was over, and they brought me back to reality. Started to slowly experience the real world again and see blurry shapes in the light. The drug was wearing off, and though I couldn't really see, I could hear the doctor talking to me, and I was trying to respond. My brain was operating so slowly that I could barely get a word out at a time, and then suddenly I started dry heaving. Medication made me extremely nauseous, so the doctor found a trash can for me to gag into and then injected me with something to stop the nausea. When he did that, I felt this intense, sharp burning pain. I was trying to ask the doctor what was happening, and he responded that he didn't know in a concerned tone, which was obviously not very comforting. Over a minute or so, the pain started to normalize, and I was able to start speaking with the doctor. I couldn't open my eyes still from the nausea, but the doctor was trying to assuage my anxiety and was telling me that the pain and the nausea were going to fade and I'd be able to leave soon. When the nausea faded and I could keep my eyes open, we left the doctor's office and sat on a bench outside to let it pass a bit more. I could barely use my legs, so my girlfriend had to help me limp the car. When we got there, I teared up describing the experience to her. I obviously was happy that I wasn't dead and I could hug her, but it was still a very terrifying experience to go through. He said intense, vivid, dreamlike states are common, and the next day we could try a smaller dose. The thought of going back in that room again the next day was almost laughable, but there's no getting my money back for the remaining sessions, and I was hopeful that this might all be worth it, and I just had to get through it. The next day, he did lower my dose, but he also gave me anti-anxiety medication, which I didn't know about until after, but the anti-anxiety medication was great. Still had intense, dreamlike visualizations, but at least I wasn't afraid. My girlfriend sat with me this time, so someone could be there with me in the room when the doctor left.
Is that human? Who is that?
No.
On the wall, there's a face. Look at that wall over there. There's a face on the top. Who is that?
No one.
You don't see someone? What is the white face on the top? What is that?
It's a hanger.
Day 2 was pretty fine, although I was still getting the arm burn from the shot the previous day occasionally. The third day, we upped my dose back to 1 milligram per kilogram of body weight, but with the anti-anxiety medication this time. I again tripped my mind out, but it was an enjoyable experience.
Like portals? Like it's like you're so disconnected. And I understand that it's like two kayakers, but my mouth is so dry. And then let me drink water earlier. But if you look at it from a different angle, it's a lion. Am I screaming?
No.
After it all, I unfortunately didn't have any reduction in my pain. The only options left seemed like either getting a spinal cord stimulator or a spinal pump. San Diego is known for having great pain management doctors. I also set up time with a rheumatologist and a neurologist, being that I was new to the area. Something that was pretty routine for me throughout the decade of chronic pain was I noticed that doctors I worked with seemed to never be up to date with terminology or procedures I was referencing in studies that I read. While there could be a million reasons as to why, I felt that maybe the doctors were so inundated with the number of patients that they had to deal with that they weren't keeping up with learning or recent studies that were being published. Up until this point, I had never received the erythromelalgia diagnosis from a doctor. Most that I would meet with would entertain the possibility, but they always said that it seems like it was CRPS. It was frustrating that I couldn't get someone to align with my understanding, and it candidly felt like no one knew what they were even talking about most of the time. CRPS and nerve pain in general just seemed like a black box that you were on your own with. I had my first appointment with my pain specialist in San Diego. I intentionally chose a doctor who appeared to be on the younger side because I thought that they might be up to date with the latest knowledge on the topic, and they were a little less locked into what they learned maybe 20, 30 years ago. I understand that people might get offended that I'm expressing ageism, and I'm not trying to make that argument. It just seemed to be pretty common that doctors well into their career would refer to certain diseases with names they're no longer called, like referring to CRPS as RSD, or not knowing about drug trials for certain medications. On intake forms, I'd explain in detail why I felt I had erythromelalgia, but I'd continually get latched to the CRPS diagnosis. I felt there might be different courses of action depending on the diagnosis, so in some appointments, I expressed to the doctors that I didn't even want to share my previous diagnosis because I already knew how the conversation was going to go. The pain specialist I met with at UCSD was the first doctor to agree that I had erythromelalgia. He also said that based on my symptoms and my current state, it did sound like CRPS was in a recessed state and certain things like surgery could pull it out. This doctor was similar to my podiatrist in San Francisco in the way that they listened to me. In my experience with the near 50 doctors I've worked with, the way that these two would look at me while I was speaking, wait for me to finish my thought and respond was very unique. I appreciated it so much typically because I was being rushed through appointments and doctors would cut me off mid-sentence, assuming they knew what I was going to say. They spent the time to listen, which was different. I let both of them know how much it meant to me. I'm sure it's one of the most difficult jobs in the world, especially being a pain doctor. You are dealing with someone who has likely gone through the worst experience of their life. Depressed, they're crying out for help, and there's probably not much that you can do. Because I was new to San Diego, each doctor I met with had their own impression of how to move forward. I was able to be seen by the pain specialist first, but the appointments for the rheumatology and neurology were 3 to 6 months out. Typically, the follow-up appointments with these doctors is going to be 1 to 3 months out, so whatever new medication they give you, you won't be able to check in and discuss it with them unless you are messaging through a text-based platform like Epic. However, in my opinion, these platforms do not at all promote the necessary communication like a call or in-person appointment offers. My body was in such a bad place, and these appointments were so far out that my neurologist suggested I schedule appointments with pain doctors, neurologists, and rheumatologists from other hospitals in San Diego. I thought it was good advice, so that's what I did. However, when I brought a suggestion from a pain doctor from Scripps to my doctor at UCSD in a conversation, his tone immediately shifted, and I thought it was going to be a repeat of the situation with the doctor in San Francisco. What he said was, well, it's fine, I'm getting advice from multiple doctors, I do need to be careful about too many cooks in the kitchen. I think it was actually a fair call out. And because the advice from one doctor to another can differ so heavily, if you're doing too much at once, you won't know what is helping or hurting you. Although this comment about too many cooks in the kitchen only came when I brought up advice from another pain doctor, not a rheumatologist or neurologist. So there could have been a little bit of defensiveness there, but I think it's a valid point for him to have made regardless. In terms of procedures, the doctors felt there wasn't enough research to suggest that a spinal cord stimulator would significantly reduce pain and erythromelalgia. Instead, the best course of action seemed to be medication. So with this doctor and a rheumatologist from his system, we spent the next year trying a long list of medications. Many might assume that these medications would be opioids, especially with the current epidemic in the US, but that wasn't the case. The typical recommendations for conditions like CRPS are medications such as antidepressants, anticonvulsants, and calcium channel blockers. In states like California, most doctors are reluctant to prescribe certain medications, particularly opioids, due to the strict regulations and the fear of legal consequences. This can leave patients with limited options like surgery, enduring unmanaged pain, or turning to alternative therapies. Physicians can face serious legal risk, including investigations, fines, or even the loss of their medical license if they're found to be overprescribing or not following strict guidelines. The expectation is that the patient is to bring the pain doctor's recommendation to the primary care so that they can prescribe the medication. But even then, primary care doctors are often just as hesitant to prescribe these medications, and many won't because they don't want the liability. The strictness of these guidelines means that the ones who truly suffer are the patients. Medications that could be highly effective for chronic pain sufferers are now off limits, and the lack of access to appropriate pain management prolongs their suffering. While it's important to have strict guidelines and monitor controlled substances carefully, current system has created a situation where those who genuinely need these medications are unable to get them. The last procedures I went through before my healing phase was an EMG in conjunction with a nerve conduction test. I read online that erythromelalgia can be a form of neuropathy, so I asked my neurologist if it would be worth trying an EMG to determine if what was happening was small fiber neuropathy or not, meaning a different class of medication could help here. The doctor noted that the symptoms did seem different, but thought it was worth getting an EMG done to determine if neuropathy could be a significant part of what was going on. When I looked up the test online, it seemed a little intimidating given my condition, but the doctor assured me it should be relatively quick and painless. I've gone through a lot of blood work and gotten injections in my feet over the course of this journey, and the test didn't seem like there was much risk for exacerbating CRPS, so I agreed it was worth pursuing. Electromyography, an EMG, is a diagnostic test that evaluates the health and function of your skeletal muscles and the nerves that control them. Your nervous system plays a role in everything you do. It helps you move, think, feel, and it even regulates the things you do but don't think about, like digestion. To reduce movement, your motor nerves send electrical signals to your muscles. An EMG can detect issues with your motor nerves, muscles, or the communication between the two. With an EMG, a small needle with an electrode will be inserted into one of your muscles to record its electrical activity. As you rest or contract your muscles, the needle electrode records the electrical activity. A nerve conduction study, the other part of this process, measures how fast and how well your body's electrical signals move along your nerves. A damaged nerve will have a slower and weaker signal. So the doctor went through this process of putting in a needle and sending of electrical pulses into about 10 different locations across my body, which of course did not feel good. When we got to the foot, the doctor told me it typically was the most painful for people because there were a lot of nerve endings in this area. When the doctor put the needle in, she reminded me not to move and the pulses were going to start. Immediately on the first impulse, my body had a knee-jerk reaction and I pulled my leg towards myself and the doctor shouted out, "Don't move," which of course I did not intend to do. I think it was the most amount of pain I've ever felt in a single incident, worse than breaking my foot or any surgery. I started dry heaving, which is a reaction that has occurred a few times in my life after extreme amounts of pain. I get really nauseous and I start sweating profusely. After 5 to 10 minutes of sitting with a cold towel on my neck and sipping water, I came to and the doctor explained that she's never had something like that happen and suspected we just hit a nerve, which was rare. She asked me if I wanted to continue and I laughed because I thought she was joking. The thought of continuing was just not something I was considering, but her reasoning was that the area is always the most painful and we were almost done with the test. If we wanted to uncover whether or not neuropathy was a contributor to what was happening, I'd have to do it again in the future. So we finished it and no other issues happened. I did end up having neuropathy, but it was just in my fingers and it was causing a little numbness, so it was totally unrelated. There's a lot that I believe contributed to my healing. When people ask me what I'm doing to help my body, my answer is that it's a combination of focusing on sleep, diet, exercise, mind-body connection, processing of trauma and emotions, and sunlight. The more you prioritize the things that you believe are contributing positively to your physical and mental health, the more you embody a person who centers their life around health. You'll naturally spend less time on things that make it difficult to maintain these health pillars like stress, alcohol, or junk food, and enable you to heal from chronic pain. I think that you have to do all of these things to have a healthy mind and body, but if there's going to be one that I think is the most important, it is sleep. If you aren't sleeping, your body and your mind cannot function. Regardless if you are doing everything else on the list, you'll still be in pain if you aren't sleeping. If you are someone who thinks you can operate off of 4 to 6 hours, I'd encourage you to consider the long-term effects. In Matthew Walker's book, Why We Sleep, he discusses research that shows consistently getting less than 8 hours of sleep over time dramatically increases your risk of cardiovascular disease, cancer, diabetes, and lifespan. Sleep is a cornerstone of human health. Every night, your body engages in critical repair processes, healing cells and restoring your brain and body for optimal functioning. From enhancing memory to fortifying your immune system, sleep plays a vital role in everything your body does. For me personally, whether or not I'd get sleep the night before was the single greatest factor in how much pain I'd feel the next day. Looking back at how my state was, moving to San Diego was one of the best moves we could have taken, and it was just the catalyst of everything slowly starting to go right. The intention behind the move primarily came because I was on crutches and a walking boot for months. We figured that we needed to go to a place where I could just sit in the backyard or a permanent pool and get sunlight, as it was really hard for me to do in San Francisco. We figured the need for more sunlight and being near the ocean was a priority, as the ocean was always helpful for me. I love surfing as an exercise, and the cold water made it like the pain wasn't even there. As both issues with my body caused pain from swelling and excessive heat, the ocean was a safe haven. Surfing was perfect for me because I was able to fulfill so many things on my daily checklist. I get more sunlight, have the opportunity to ground myself in nature, get exercise, and can meditate on the water. Very easy change to make that will have massive improvement on your mind and body is getting natural sunlight in your eyes within an hour of waking up. Sunlight is nature's most powerful medicine, directly influencing our mood, hormones, and overall well-being. Exposure to sunlight in the morning helps regulate your body's internal clock, promoting better sleep at night. Sunlight boosts testosterone and estrogen levels, as well as stimulates a neural pathway that triggers the release of dopamine, enhancing both brain function and mood. The increase in norepinephrine farther energizes the body, leaving you feel more alert and energized. Exercise is especially difficult to maintain when you have chronic pain. For me, it's a surefire way to trigger a flare-up. If I go for a run or lift weights, my body reacts almost immediately. But avoiding exercise only makes things worse. Not using your muscles can lead to atrophy, poor sleep, a weaker immune system, and worsening symptoms over time. The key is staying in motion. Most of us live sedentary lives, so it's important to be intentional about movement. If you work at a desk, get up at least once an hour to stretch, maybe do a few squats or push-ups. Aim for at least 7,000 steps a day. Maintaining muscle mass is crucial for overall health, longevity, and even brain function. Muscle plays a vital role in regulating glucose, supporting metabolic health, and combating insulin resistance, which is essential for managing obesity and chronic diseases. This is why I maintain consistency with resistance training. Diet became a big focus for me again. I removed basically all processed foods and avoided eating out unless it was sushi or a nice Italian spot, maybe once every month or two. The diet mainly consisted of high-quality meats, organic fruit, and organic veggies. I never had doctors ask me about my diet or lifestyle, which is pretty surprising considering how many doctors I've met with at arguably the best clinics in the nation. It's even more surprising when you consider diet and lifestyle are some of the most important factors in reducing pain. The American food system, which prioritizes convenience and cost over nutritional quality, plays a significant role in the rise of chronic pain. The consumption of ultra-processed foods contributes to obesity, inflammation, diabetes, and other conditions that are directly linked to chronic pain. Read the labels. It's fascinating how sugar, seed oils, preservatives, and additives are in almost everything. Ultra-processed foods now makes up 73% of the US food supply. These substances increase inflammation in the body, a key factor in managing chronic conditions, including pain. Government subsidies primarily support commodity crops like corn, soy, and wheat, which are key ingredients in ultra-processed foods. Meanwhile, fruits and veggies receive a fraction of this financial support, making processed foods cheaper and more attractive for large corporations to produce. This isn't just about the FDA. Congress has set the policies that make processed foods the most accessible and affordable options. GRAS substances, or generally recognized as safe substances, are food additives that do not require pre-market review by the FDA. In 1997, the FDA loosened a regulation which allowed companies themselves to declare substances as GRAS without notifying the FDA. A report on the U.S. Food Additive Regulatory Program estimates that the number of chemicals approved for the use in the U.S. to be around 10,000. That's 5,300 food additives and about 4,600 GRAS substances. Looking at the European Union for comparison, they've only approved 411 additives and have no GRAS substances equal. This also doesn't include the indirect chemicals you get from processing, like heavy metals or plastics. Looking at the rates of chronic diseases in the US, you see a stark narrative. 74% of Americans are overweight or obese. 50% of Americans type 2 diabetes or prediabetes, up from 1% in 1950. Young adult dementia has tripled since 2013. Half of Americans are expected to have cancer in their lifetime, and young adult cancer has gone up nearly 80% in the last decade. 1 in 36 kids have autism, up from 1 in 150 in the year 2000. Infertility is going up 1% every year. 25% of men have erectile dysfunction, and autoimmune rates are going up over 10% per year. I tried a lot of different diets with the intention of uncovering what made my body feel the best. It seems like there isn't a one diet fits all, and you need to figure out what makes you feel good. I did vegan, vegetarian, carnivore, animal-based, and what I found for me was, for the most part, I feel best when I'm eating whole foods. However, to sustain the cardiovascular activity and resistance training I was doing, I need to eat at least a gram of protein per pound of body weight from grass-fed, wild-caught, pasture-raised meat. Protein provides critical building blocks for muscle repair and synthesis, but also improves metabolic health. I do still occasionally eat out, but for the most part, it will upset my body. For myself and others I've met who have chronic pain, diet is one of the most obvious things that affects their pain levels and symptoms. And in a world where everyone is arguing about which diet is optimal, I think looking at how food affects pain through inflammation in chronic pain patients is a good way to do it. I understand alcohol is a tricky one for a lot of people. Alcohol does negatively affect your health. However, if you want to have a drink at a wedding or a dinner, then celebrate. Like most things in life, moderation is key. Whether it's food, alcohol, staying up late, live your life, but limit the intake of these detractors. An easy way to think about it is the 80-20 rule. Don't do one of these detractors more than 20% of the time. This section for me, I believe, is the most powerful. It seems to be relatively common knowledge that sleep, diet, and exercise are good for you, but I think it's not known how much of your physical state is dictated by your mental state. How trauma you experience can manifest through physical ailments doctors can't seem to help fix. During this catastrophic period of time, we visited some of our friends in San Francisco. They had us over for dinner and we got on the topic of my restrictive diet. I explained how it was centered around a chronic pain disorder I was dealing with, and they mentioned that they had a friend who actually found a company called Menda that was based on treating chronic pain through neuroplasticity and pain reprocessing therapy. Pain reprocessing therapy involves learning techniques to help your brain interpret pain sensations in a new way. What this means is that if you change the way you think about pain, it can change the amount of pain you're feeling. So what is pain? Pain is your brain's way of protecting you and preventing tissue or structural issues from occurring with your body. When you touch a hot pan on the stove, the pain you feel is your brain's way of communicating that you need to stop touching this or damage is going to occur. However, sometimes the brain can get it wrong. Your brain can think that you are in danger and can create pain when it's not necessary. With chronic pain, you start to feel pain in a certain area, let's say a headache or a stomach ache, but instead of fading like it normally does, pain continues. As time goes on, your brain becomes very familiar with the sensation. It can worsen, spread, and your brain accepts this as the new normal. In my instance, it was post-surgery swelling all the time. Over the next 6 months, I worked through the psychology of my pain and the experiences that I've had in my life leading to where I was in the present. I focused on the thoughts I'd have when I started to feel pain, the words I'd say to myself in my head, or the ways I'd communicate to others about the experience. So what this looked like for me was when a flare of pain symptoms would happen, rather than giving into the fear and thinking, here this goes again, this is going to be how, it's never going to end, try as hard as you can to say the opposite whenever you're describing it, whether it's in your head or to others. So you'll say, I've been here before, I'm slowly improving, this isn't dangerous, it's just pain. It's very difficult to do, but as time goes on and the more you say it, the more you start to feel it. I became very self-aware of the person I was and how I was affecting those around me. The way I viewed myself changed and the world around me started to change. Felt like there was a shift and my mind quickly got to a better place. Things that used to easily make me irritable, I was able to just handle a little better, and it wouldn't stress me quite out as much. The world felt just a little lighter. My optimism noticeably improved for myself, and in conversations with friends, I could tell they noticed the change as well. The chronic pain that I felt started to dissipate. My plantar fascia and my metatarsal pain was less frequent. There was less bruising, and it felt like I was healing. My partner and I would often talk through what I was learning from my therapist, Amanda, and she'd help push me to practice these habits because she was often the one who had to hear me complain about pain. My partner helped me identify that I had developed a habit through my life where I would fear that the worst case scenario was always going to happen, and I'd unnecessarily stress myself out through the process. It wasn't just with pain. I was creating anxiety in most scenarios of my life. I worked on removing this fear, and it had really positive effects. Controlling the reaction you are having to your pain can reduce the severity and the frequency of the pain, and I found that to be a very interesting concept. If you lower the amount of time your nervous system is in fight, flight, or freeze, your physical and mental health will improve. Nervous system activation are scenarios you deal with high stress, say you're slamming the brakes in traffic, you make a mistake at work, you're talking politics at Thanksgiving. A common theme that pain science literature notes is that people who have chronic pain likely lived in a way where they are routinely bringing their nervous system to this exasperated state. With chronic pain, you feel high stress most of the day and your nervous system is constantly on high alert. While maintaining the practice of keeping my nervous system in a low stress form, I'd apply this will pass in all areas of my life outside of pain. I use this practice to handle emotions and all of life's stressors as much as I could. I still fail to do this all the time, but it's a practice. Like most things in life, growth isn't linear. You need to remember that you are human, you'll make mistakes, and you're doing the best that you can in these moments. I've always been pretty critical of myself in all things. I've always had the expectation for perfection, and when a mistake was made, I would not have room for grace. This has changed. I maintain the growth mindset and try to give myself grace as much as possible. I remember I'm doing all that I can with the cards I was dealt, and I've noticed far fewer emotional lapses than before. I experienced trauma in childhood, and rather than talk to anyone about it to process the emotions, I instead became very good at hiding the actual way I felt. I learned how to walk into a room and put a smile on my face regardless of the situation I was in. I learned early on not to share what was going on in my life to make others comfortable. I could consistently compartmentalize my emotional state and enjoy the experience as best as I could. I got so good at this from childhood that in college, most people that knew me didn't know I even had a pain condition. For the majority of the time I've dealt with chronic pain, I rarely spent time talking about it. Well, now I speak very candidly about it. It took me years to get here. I think a lot of it had to do with me lowering the insecurity of what other people might think about me, but I also feel that difficult situations are not always a welcomed conversation. Most of my friends would never bring it up. I'm assuming they may have thought I wouldn't want to talk about it, or they'd forget it was even an issue because I was so good at hiding it. To me, it would feel like no one understood what was actually happening, and it was pretty isolating. Even today, when I share what's going on in my life, comments that I get are sometimes just a little shocking. There's a portion of people who seem to not be able to handle the reality of my situation and try to get through the chat as soon as possible. You get a lot of let's chat about something lighter, or all right, let's talk about something else, or not so depressing, which I still find a little insensitive, being I'm just talking about my daily life. But some people are just not as comfortable talking about difficult topics, which is fine. You can't take offense to that. I feel that I never communicate in a way where it sounds like I'm asking for help or pressing them. I'm just answering their questions, and it seems to make them uncomfortable. While I'm self-aware of it not being a light conversation, sometimes conversations lead where you can't intentionally be vague unless you're just lying to them. But I do feel that's just a part of it. I try to compartmentalize other people's comments to me because I do understand why it's difficult for them to get it. They haven't gone through an experience that would make them understand, and they're probably not aware of how it's making me feel. The psychology of chronic pain is an interesting concept to me because it's connected to all parts of your life. Pain is involved with almost everything you do. If you can think about important parts of your life, whether it's sports, arts, a pet, while you think about those things often, they aren't connected with every thought you have in a day like chronic pain is. When you're cooking food, exercising, sitting, sleeping, showering, doing anything, the pain is there. It's very scary. It impacts your life heavily and quickly. You make pain your everything. Like a heavy addiction, it's not good, and there are strategies you can leverage to navigate it. The big portion of improving your mind-body connection is processing past emotions and trauma. In Bessel van der Kolk's The Body Keeps the Score, Bessel explains that trauma isn't just a psychological issue, but can also have profound changes in the brain and the body. People who experience trauma, especially during childhood, often suffer from long-term physical health problems. Trauma affects the limbic system, which is emotional regulation, and the prefrontal cortex, which is logical thinking and decision-making, leading to heightened emotional reactivity and difficulty in regulating emotions. Trauma can manifest as chronic physical ailments like autoimmune diseases, chronic pain, gastrointestinal issues. This is especially true for individuals who experience childhood trauma, such as abuse or neglect, or those exposed to combat, like veterans returning from war. Trauma survivors often develop somatic symptoms or physical symptoms with no clear medical cause because their bodies hold on to the unresolved emotional pain. This is why trauma survivors often have high rates of untreatable physical ailments, including headaches, back pain, and even digestive issues. Trauma is much more common than it's made to be. Some of the most striking statistics shared early on in the book are that 1 in 5 Americans are molested, 1 in 4 grew up with alcoholics, and 1 in 3 couples experience physical violence. Communicating your trauma, whether it's to yourself in a journal, to a close friend or a partner, or even a therapist, will have massive effects on your physical and mental health. If you are someone who experienced trauma, there's action you can take immediately in the comfort of your home to help. Even if you don't have trauma, I believe it will improve everyone's life going through the exercise. It's a 4-day journaling protocol. Each day for 15 to 30 minutes, you'll write in detail about the most traumatic or mentally taxing experience you've gone through. After the 15 minutes, give yourself 30 minutes to decompress. Sit alone, don't listen to music, don't go on your phone, just be and reflect. Andrew Huberman, a well-known neuroscientist, and professor at Stanford, found it to be so effective, he hosted an entire episode on his podcast talking about it. I did the exercise. Since that point, I look back at what I went through an entirely different lens. Rather than it being a difficult thing to even think about, I'm now proud of what I overcame and can talk about it like it's any other story, and I believe it was one of the most important aspects of my healing. It feels to me very cosmic on how my life has unfolded. It made all of the difficulty that I've gone through sort of feel like it led me to this exact moment. For the last decade, I've been exploring ideas on how to heal the body and the mind, from breathwork, meditation, ice baths, and pain journals. There isn't necessarily one thing that will guarantee to help heal you. I believe it's a process of trial and error, finding what works for your body, brain, and mind. Most of the concepts that have helped me heal were never brought up to me by a doctor. My intention behind this documentary and the content I intend to put out in the future is to help people navigate a scary and difficult world. When the doctors you go to for medical assistance fail you, it's up to you to push forward, advocate for yourself, and heal. From this journey of chronic pain and healing, there are key learnings that I want anyone going through something similar to keep in mind. First one being, don't worry about what you can't control. Self-blame used to be very difficult for me. It's hard for me to accept that I was the one who slipped and did this to myself. Thinking about the what if I didn't fall, would any of this have happened? Couldn't really imagine not feeling this guilt, but the way I view the world now is just so different. Things happen and you can't control it. The only thing you can control is the way you respond to the situation and see positivity rather than negativity as much as possible. Though it's hard to see in the moment, it's through these difficult times that we grow. The challenges that we face today shape the stronger, more resilient person we become tomorrow. Remember that comfort is easy and growth is hard. Communication is key. Candid communication can be transformative in every area of your life, especially if you're dealing with chronic pain. Whether it's with family, friends, or coworkers, sharing openly can unlock opportunities for understanding and support. In my 30 years on Earth, the past year brought the most change because I finally started speaking candidly about what was happening to me. People can't read minds, and by opening up, I learned that a close family friend had been dealing with a similar chronic pain situation for years, something we never talked about until I was honest about my experience. It's tough in the moment, but candid communication brings clarity, helps others understand your struggles, and opens up the door for more meaningful support. Get a second opinion. If it's possible for you to do, get a second opinion. There are many instances in which surgery isn't necessary, but that can be the first thing that doctors recommend. Surgery and medication is the instant resolution. There's no analysis into your habits or lifestyle. The surgeon who did the original surgery for my foot break and the one who put the cast on too tight was accused from other patients on Yelp for doing surgeries when they believed it wasn't even necessary. So get a second opinion. Keep in mind that doctors are measured by patient output, not patient outcome. As a human, I like myself more than ever. I love the person I've become after going through all of this, and I'm really proud of what I got through. But I'm still in the pursuit of health. While it's very manageable, I still feel pain every day. If you are someone who believes you can share something that would help me or someone in my position, please share in the comments. I'd love to learn something new. If you are someone who's interested in hearing more about my experience, please also feel free to reach out. I'd love to help in any possible way I can. If you made it to this point in the video, thank you so much for watching. I appreciate the support more than you know. If you found this content interesting, liking, commenting, or sharing the video will really help with awareness. I also plan to put out more content related to physical and mental health in the future, so follow my channel, see what comes next.